So we do work closely with the NHS, and actually, before I joined the charity during COVID, the charity played a massive role in supporting the NHS when the NHS were taken over by COVID patients. So
Right.
we took on cancer patients for them and really provided a real backup service. So I think there's a good relationship. We provide, I suppose, a number of different areas, predominantly elective recovery or elective care operations. So we work closely with trusts. If they need more capacity in certain areas, in certain fields, then we have the availability, and we provide that to them. And
just to pick up on that, so what that means is basically there's a backlog or whatever. There's patients waiting for what is an elective. Does knee surgery count as elective, or what's elective? Knees, hips, stuff like that. What that means is Nuffield's, because you have hospitals, because you have surgeons, because you have clinicians, you can come in and actually take those patients so they'd be treated earlier than
So we've been working with all the trusts on helping them bring down their wait lists over the last 2 years.
So it's a pretty that sounds pretty symbiotic to me, right?
It is. Obviously, it's very local, so it does vary locally depending on the need, the availability. So they will work with all providers in the same way. We provide a good overflow service, particularly to helping with the backlog. What we're also starting to do, though, and actually we talked earlier about some of our what we call our flagship programs, which are our free of charge services. We also provide those to the trusts. So working with over 20 NHS trusts, we actually provide our COVID rehab program, which we developed off the back of COVID. People really struggling with the long-term effects. So in 60 of our fitness and wellbeing centres, we provide that. Over 4,000 people have benefited from it already.
Wow.
And so we do that. We're also just starting to launch other services as well through them. So ideally, like we talked earlier, we provide an end-to-end everything to do with your whole health. So we would love to expand and do more to support the NHS from prevention right through to rehabilitation.